Oh. Hi, I'm Dr. Aaron Bates, your Ventura County Spine Authority, and today we're going to fix trauma-induced migraines. You know what, Doc? I don't think this really pertains to me. I get migraines, but I've never had a trauma whatsoever. Believe it or not, the majority of migraine sufferers have some type of trauma in their history. Yeah, but I've never had a concussion. Well, how about any trauma to your neck? When you have a trauma or a neck injury, you can actually misalign the bones of your upper cervical spine, which we have actually found to have an 88% correlation to most forms of headaches. One of the frustrating things about trauma-induced migraines is after the trauma, it can actually take months, even years to develop migraines. Then oftentimes we hear patients say something like this. This one time when I was younger, yeah, that might be the reason. The cuts and bruises from a trauma can take weeks or even months to heal, but the structural misalignment and neurological damage can last you a lifetime.
About a decade ago, I suffered a brain trauma injury, and I've just had trauma to my head and migraines pretty much daily since. I've tried everything that the doctors have recommended. Everything from pills to movement to relaxation, and none of the above have worked. My left eye does start swelling shut. By 2 p.m. I have to take my rail packs to get me through the rest of the day because I'm already at like a 12 plus in pain. Rail packs, and it costs about $1,000.43 for 24 pills.
How long does that last you?
24 days.
If you suffer with migraines, then this is the most important bone that you need to have assessed. It's called the atlas, and it actually surrounds your brainstem at the top of your neck. It rests right underneath the occiput, which is the back of your head, which makes it incredibly difficult to assess and also correct. But 9 out of 10 people who suffer from headaches will have a structural problem of the upper cervical spine right here. When you have an atlas subluxation, it puts pressure on the brainstem, which will affect 10 out of the 12 cranial nerves, which can cause different types of tension headaches or cervicogenic headaches, or the classical migraine. Now we have 3 objectives we want to confirm. This is Jeff's x-ray. This is his upper cervical spine. We see through his mouth. He has his mouth open, and you're going to see the atlas here is actually laterally translating across. You can see the lateral mass has more space between the dens here than it does on the right. You're also going to see facet sclerosis here. That's degenerative joint disease due to the misalignment. And we're also going to see a wider lateral mass here, which is also an indication for an anterior rotation on this side and a posterior rotation on this side, which essentially means the atlas has moved exactly like this. Now we're going to do a neurological assessment with migraine sufferers. The most common neuropositives we find are with the optic nerve, cranial nerve 2, and the vagus nerve, cranial nerve 10. Okay. Cranial nerve 2 is your optic nerve, which is associated with vision and accommodation, and cranial nerve 10, which is your vagus nerve, which helps regulate your swallowing as well as your resting and digestion. Next, we use digital palpation to confirm spinal misalignment, as well as the tonicity of the suboccipital muscles, which play a huge role in the alignment of the spine. Next, we do motion palpation of the cervical spine. When we put the neck in full flexion, we can actually isolate the range of motion of the upper cervical spine, which helps us find the rotational component of the vertebral subluxation. You can see his head rotates way further to the left than it does to the right, positive for a posterior rotation of the cervical spine. We also do palpation of the cranial bones, which play a huge part in migraine correction. We've done better analysis. We have a more specific listing so that we can get a better result. Now we do myofascial release on the suboccipitals. Post-check of the range of motion. Started out good, better, perfect. We use low-level light therapy to help stimulate the neurology and activate cellular healing. one of our secret weapons for headache relief and resolution. Now we're going to adjust the cranials to regulate blood flow and activate the nervous system. The biggest concern with all forms of migraines is that people feel helpless. They think that there's no solution, that these issues are genetic or they're environmental, and the truth is there are far more solutions to these problems than people realize. And if we do this right, if we address it right, then oftentimes we get results like this.
Since I've been seeing Dr. Bates, I'm down to 1/3 usage of my medication, which is financially great, and for my body, exceptionally great. You can relieve it. I can go through the day without taking medication. Been off narcotics for a long time, and basically the chiropractics take the pills away. And none of the above have worked. Chiropractic works.
Perfect. And then